Hello, BMC friends and family. My name is Sebastian Hamilton, and I'm the Associate Chief Pharmacy Officer here at Boston Medical Center for the Outpatient Pharmacy Department. I just want to take a couple of minutes to share with you what we're doing in our department to really address the COVID-19 pandemic. And the primary way that we're doing it is really trying to drive as much volume and patient prescriptions into our mail order pharmacy, whether it's from our on-campus pharmacy, BMC health plan members, and of course our new community health center partnerships. We're trying to reach out to as many patients as possible to offer up our mail order service. And this does a couple of things. It's important because it really helps them make sure that their medication therapy goes uninterrupted during this time as they stay home, following CDC guidelines, as you know, to self-quarantine. We don't want them to go without medication because they are following the proper guidelines around that. And so we make sure that we can drive their prescription into our mail order pharmacy and have the United States Postal Services deliver it to their doorstep so they can remain safe. And obviously staying home and self-quarantine reduces the exposure or risk to being exposed to COVID-19. So it's very effective that we continue to drive as much volume into a mail order pharmacy as possible. Another thing that we're doing is watching our drug inventories and making sure we secure enough inventory to meet the 1.5 million prescriptions we process a year. I'm sure you've heard about the hydroxychloroquine and azithromycin potential hoarding going on, and we're making sure that we're being very circumspect to address every prescription that comes in for that, and not just those two drugs, but all agents, so that we have enough supply to meet prescription demand, because we want to make sure that those medications go to the appropriate patients and all our patients as needed who at Boston Medical Center as we go through this pandemic. We anticipate some drug shortages over the upcoming weeks and months, and we're being proactive to keep our eye on that so we have enough supply. And I think the last thing I'll mention real quick is our just dedicated pharmacy team members. They really come in and show up pretty much every day since this pandemic began to do all the right things that we do to make sure our patients and employees get their prescriptions in an uninterrupted manner. And I think that's very important during this time, and our team just comes in and making sure that they're on the phones, reaching out to patients, driving prescriptions, mail orders, I mentioned. So I think all those things are very effective to get to where we are today, and we can support what we can for here at Boston Medical Center to keep our patients healthy. Thank you, and everyone be safe out there.